So welcome to Aware and Care. I'm Mike Brach, physical therapist at Tribe Wellness. We're lucky today because our good friend Marcie is volunteered to do a presentation for us with information that she received in a formal training from the Parkinson Foundation. We're also going to attempt to record this thing with the hope that we can edit out everything that's not the main square and then see if we all like the production value of it. If so, we'll upload it to our YouTube channel. So hopefully, if there's helpful info, you can call back on that info on our YouTube channel. But also you see in the chat that Marcie has put her contact info in there should you have more questions, or you can always contact me and I can get you in touch with Marcie, no problem. So with all of that being said, welcome everyone. I hope you're not offended that you're muted. It's not that we don't value what you have to say, it's just we want to minimize background noise. I'm going to now switch over to have Marcie as the host of the meeting. And just before I do, I want to say we're really lucky in Dallas because we've got so many resources, right? We've got, obviously I love what we do here at Tribe Wellness, but none of that would be possible too without all the other resources in the area. You know, things like the Dallas Area Parkinsonism Society, things like the Parkinson Voice Project, things like our strong presence of the Parkinson Foundation and the wealth of movement disorder specialists that we have here, both at UT Southwestern, at Neurology Consultants of Dallas. We even got some in the Baylor system, and we've got some independently. So we've got a wealth of resources. And as a result of that, we've got people like Marcie who can share with us what it's like to do the right things, to take care of Parkinson's symptoms, and also information like she's going to share with us today about how to prepare to get the most out of managing your symptoms for either expected or unexpected stays at the hospital, and also just a wealth of other experience. I'm going to shut up now. Many of you have heard me talk often and sometimes for too long. I'm sure you will value more of what Marcie has to say. So let's see here. I'm going to spotlight your video, and then I'm going to cancel mine, and then I'll see if I can make you, oh, I didn't even need to make you the host. Well, let me make you the host anyway.
Can you see my screen?
Yes, ma'am.
Okay, I just want to make sure. Because just because I can see it doesn't mean you all can see it, so.
All right.
So you good?
You're the host now. You're driving the bus. I'm going to mute myself and get out of the way. Thank you once again, Marcie.
Well, thank you, Mike, and I'll be happy when we're back boxing at Tribe. I go there once a week, one-on-one, but it's kind of a shame that we can't all be together. So hopefully with the vaccine coming out, that may be, well, still months away, but at least there's a light at the end of the tunnel. I became an Aware and Care ambassador for the Parkinson's Foundation. There's about 100 or so of us around the country, not necessarily 2 per state or anything like that. Some states that don't have any, and some, Texas has more, just being a bigger state. I'll explain a little bit about what our role as an ambassador is as we get further through the presentation. Some of you may have seen the presentation I did the other day, Wednesday evening, for Beyond the Diagnoses. That was a much shorter version of this. So this one will take a bit longer, but that was just kind of a condensed version. So why are we here today? We're here to help people affected by Parkinson's understand the risks associated with hospital stays, and we'll discuss what those risks are in a little bit. To get tools to play an active role in their care, to be prepared for a hospital visit, whether it's planned or unplanned, and to develop some strategies to get the best possible care while in the hospital. most of us, at least, most of us, at least pre-COVID, probably when we were going into the hospital, we viewed them as being safe, at least for the most part. Now, maybe since COVID, not so safe, but prior to that, I think most of us would say, yeah, hospitals are safe. Well, that may or may not be true, depending. So I think most of us going in, those of us with Parkinson's would immediately assume, well, they'll call my neurologist. Of course they'll call my neurologist because Parkinson's is such a big part of my life. Well, if you go in there for maybe DBS, well, yes, they will likely call your neurologist in that instance. But if you go in for a heart attack, not necessarily. They may not even know you have Parkinson's. So assuming that they will call your neurologist isn't always a great assumption. Then we may assume, well, the pharmacy will have my PD meds. Well, they may have your PD meds, or they may have something similar to your PD meds, or you may be on continuous and they're going to give you something different. So you can't assume that either. You'll just assume, well, the staff will understand my PD symptoms. Well, they may not. And this is not a knock against doctors or nurses or hospital staff or hospitals. They may be great hospitals. They may be great doctors and nurses, but they may not understand your PD symptoms. There's about 1 million people in the US with PD right now. And although that sounds like a lot, and it is, I'm one of those million, so I'm not making light of this at all. But when you look at it as a total, compared to the total population of the United States, it's a relatively small percentage. So those hospitals may not have had somebody come in anytime recently who had Parkinson's disease. So they don't even know that there's an issue with some of the things they're doing. So again, they may be great hospitals, but sometimes people just simply don't know what they don't know. And it's our job to try to educate them so that they do know. We may also assume that they'll bring me my meds on time. Well, the way you take your meds may not be how the hospital has things scheduled, because the hospital will have a schedule as to how they give things out that makes the hospital run as efficiently as it can, which of course is its goal to run as efficiently as it can. But that could be very detrimental to a PD patient taking their meds. And then lastly, they will know the drugs that are unsafe. If it does not show that you have PD on your chart, or now it's electronic, it's not actually a chart anymore, but you know what I mean. And they're not even sure, and we'll find out later how you may not even be getting your meds. They may not be checking that any drugs that they're giving you are safe or unsafe. So again, it's kind of up to us or our caregivers to make that known to them. Again, it's simply, sometimes people don't know what they don't know. So when we talk about inpatient care of people with Parkinson's, and when they're compared to control cohorts, PD patients have a higher rate of hospitalization. They are 44% more, they have a hospitalization rate 44% more than their peers without Parkinson's disease. So that is a significant percentage. When Parkinson's patients go into the hospital, their duration of stay is substantially longer. And it varies across studies. Some studies as low as 2 days longer, some as 14, but any day longer in the hospital is not good. Most of us don't wish to stay there. Unfortunately, PD patients have avoidable complications, and they're higher than their peers without Parkinson's. And again, I guess the key word there is avoidable. This does not have to happen, but their avoidable complications are higher than their peers without Parkinson's disease. And unfortunately, PD patients are less likely to be sent home after being hospitalized. On average, only 33.2% are discharged to their home, 62.9% are discharged to a facility, and sadly, 3.9% resulted in inpatient mortality. So again, only a third are going home directly from the hospital. The rest are not. And that's a pretty high percentage that are not going home. Here you see a bunch of people standing there, and there's 12 of them all lined up, and all of those 12 have Parkinson's disease. And of those 12 people, 4 of them will be hospitalized in 2021. And of those 4 people that are hospitalized, 3 will not get their right medicine on time. And again, of those 3, 2 will have complications as a result. So 2 of every 12 people with Parkinson's, or 1 in every 6, will have avoidable, and again, that word avoidable, this does not have to happen, will have avoidable complications because the hospital doesn't understand their needs. And again, as I spoke about before, they may just not be seeing that many people with Parkinson's. So they simply don't know what they don't know. They're not going out of their way to not do the right thing. They just don't know that they're not doing the right thing. So here are some of the ways that Parkinson's patients may have issues with their medications while hospitalized. First of all, the medications may just be missed entirely by error. And it's often because PD is not mentioned in the electronic medical record. Now it's more likely to be noted if the presenting issue is related to PD. So maybe you're going into the hospital for DBS, more likely that it's listed. You're going in for a heart attack, not so much. So your medications may just be missed entirely. Or the medication is omitted and it's withheld. They know you need the medication, but they're withholding it intentionally because a clinician incorrectly assumes that NPO, which is the Latin for not by mouth, indicates that they should omit it. And in their view, the difficulty swallowing justifies that omission. The problem is, without those meds, that swallowing will become more difficult. And then the PD patient just ends up in this loop that they can't get out of. So that's problematic as well. The medications may be delayed. They are not being distributed precisely at the home schedule, but rather follow the standard 1-hour window and/or were set to the hospital standard distribution schedule. Many hospitals have a very standard set schedule that they follow. So it may be that they're giving out meds 3 to 4 times a day. Or again, they consider it on time if it's within that 1-hour window. However, as many of you know, for many PD patients, that can be catastrophic. That is really plummeting them into an off time, depending upon how many times they take their meds and and what doses that they need and how they have to take them, depending upon the brand. So that can be very costly for a PD patient to have those meds delayed. And I've heard so many stories. I just received an email from somebody who watched the presentation for Beyond the Diagnoses, and they were not getting their meds and then got them at off times. And this person was in the hospital for DBS. So they knew this person had Parkinson's and there was still a problem with it. Now, for me personally, right now, I take 1 razagiline a day. So if I had to go into the hospital, I could fit within the hospital's schedule. It wouldn't be a problem. But that may not be true 10 years from now. And that's not true for many PD patients in general. So that can be a huge problem. And then lastly, the medication may be substituted. They don't have the exact formulary they don't have the exact medicine that you take in your dosage available in their pharmacy. So they're substituting things. So you may take immediate release, but they're giving you continuous. You may take a generic, they're giving you a name brand. And for so many PD patients and their doctors and their movement disorder specialists, they have worked quite a long time to get those medications precise so that it's working well for that particular patient. And obviously substituting can throw that whole thing off. And many patients, like I said, the stories I've heard end up just really in bad shape because these kinds of things are happening to them while they're in the hospital. Here we go. Anti-Parkinson medications are as necessary to a Parkinson's patient as insulin is to a diabetic. And again, for all the reasons I just discussed there. And it says often PD medication schedules are changed in the hospital. This change may result in greater risk for disabilities and consequently an increased risk of accidents and other complications. And it can be life-threatening. So this is serious. It's not just, oh, you know, I didn't get my Tylenol on time. For many PD patients, this is really very, very serious for them. So why is this happening? Well, seemingly minor errors by anyone providing care can mean a crisis for people with PD entering the hospital. So again, here in the middle is the person with Parkinson's. And around them are all the people, when they're going into the hospital, who may in one capacity or another interact with them. So if it's a planned admission, it could be even your Parkinson's disease doctor, your movement disorder, or the unit nurses where you're going. If it's an emergency admission, then there's even, you know, first responders, ER nurses, ER physicians, and then all these other people here, depending if you need surgery, it may be an anesthesiologist or a surgeon. It could be a physical therapist, a dietitian. It's all of these people. And if all of them really don't know what's going on and take a team approach to it, they could also be doing very contradictory things that can be very harmful to the patient. So again, why is this happening? And again, it gets back to sometimes people just don't know what they don't know. Lack of awareness of the critical importance of Parkinson medication timing. They just don't realize how important that is for PD patients to get those medications in a timely manner. Lack of awareness that poorly managed Parkinson's might result in mental confusion and other serious symptoms. And also the lack of awareness that many common medications for pain, nausea, depression, and psychosis are unsafe for people with Parkinson's. Even in the best hospitals, even when treated by centers of excellence, unless we intervene. And the centers of excellence are, there's about 50 of them worldwide. It's a designation given by the Parkinson's Foundation for those hospitals that are considered centers of excellence regarding Parkinson's disease. Most of them are in the US. There's about 10 or so overseas as well. But this happens even in those institutions that are the best at what they do regarding Parkinson's. And these things are still happening. So that's why it's very important to be your best advocate so that these things do not happen to you. So what is the solution? Every care provider must prioritize the involvement of the primary PD care provider. So here again in this circle, the person with Parkinson's is in the middle. Your primary PD care provider. The hospital must be told how important it is that this person is involved. Value the knowledge of the person with Parkinson's and the family care partner. You as the person with Parkinson's know best about you. You know how your medicines work. You know when you're off. You know when you're on. You know what you're feeling. If you can't communicate that, then obviously the person most able to is your family care partner. So it's important that your care providers value that, you know, the saying, if you've met one person with PD, you've met one person with PD. We're all different. We all have different symptoms. So it's important that they value what you have to say. And then lastly, understand and utilize the recommendations within the Aware and Care materials, which we will talk about. So that is up here as well, and your family care partner. And then around that is all the doctors, nurses, dietitians, PTs, et cetera, that you may come in contact with while you're hospitalized. So things to remember. Each person with PD has a unique combination of medications and listed regimen. So for every single one, it is different, and likely your doctor, your movement disorder specialist has worked very hard, and you have worked very hard to get those precise, that what works best for you. So it's very important that when you're in the hospital, that is maintained. Each person with PD has the best knowledge of their disease and other conditions, but may have communication challenges. Again, you know best, you know what's best for you, and it's important to speak up, or if there are communication challenges, that you have a champion that will speak up for you. Care partners can have all of the above information and advocate for the person with PD. And the aware and care materials should be used from admission to the hospital through discharge to ensure best practices are followed while there. So Aware and Care is here to help. The Parkinson's Foundation Aware and Care campaign can help everyone be better informed. The person with Parkinson's, the care partner and other family members, healthcare providers, and hospital and facility staff. The Aware and Care Kit helps patients and families plan for a hospital visit and advocate for the best possible care during the stay. And the Parkinson's, I don't know if you know this, but the Parkinson's Foundation does run a helpline that is available. It has quite extensive hours. You can call in virtually about anything. And you can see these are the one on the left-hand side, the doctor was about to give the patient a particular medication, and the patient looked it up in the kit, and it's not appropriate for people with PD. That medication will likely interact with meds that it will be a bad interaction. And then another patient said this was their first time at a hospital when a nurse was aware of the importance of meds being on time for Parkinson's patients. Because again, most don't really realize, so they will let it fall within the hour window or fall when the normal distribution time is for medications. And that just does not work for Parkinson's patients. So how can you get the information for the Aware and Care Kit? And there are 3 ways to get it. You can download it online, and that's if you want to access all the printable resources, and there's no cost for that. You can just download them, and you can see the website there, parkinson.org/awareandcare. In addition, there's a packet that you can also order online or through the helpline, and there's no shipping charge with that. Or you can get the entire kit, and you can order that online. It does have an $8 shipping charge, but there's no fee for the actual kit. Or the kits can be distributed by Centers of Excellence or Parkinson's Foundation staff and volunteers, that would be me, at no charge. So if you note in the chat, I did put my email, and if you live in the Dallas Metroplex and you give me your contact information, I'm happy to deliver one personally for free. I wear a mask, I'll leave it on your doorstep, what have you, no contact, but I can get it to you for free. And we'll go through what's in the kit in a second. So this is what the kit looks like. And I've determined as I'm doing these, I would be a very bad weather person because I never know which way I'm supposed to go. So good thing I didn't want that as a career. But anyway, in the kit has all these materials that we're going to look at. And the first one they talk about there are fact sheets for nurses. It's a tear-off pad, and you can get that either, you can download and print it if you care to. It's in the Aware and Care packet, and it's also in the kit, but it's a whole kind of, you can see it's pretty big actually, and they're just tear-off sheets. And it helps the nurse to know, it lists critical clinical care considerations, medications that may be contraindicated. So the nurses have some idea of things that might be going on with you. And that you can get any of those 3 ways. The next thing that's in the kit is a medical alert card. You can download and print that for free. You can order the Aware and Care packet for free, and it will be in there. Or it's also in the Aware and Care kit. I did fill mine out. It is in my wallet. It just gives personal information, medications to avoid. It also does make a point and says, I am not intoxicated. Please call my family or physician for help if somebody is having a bad episode. But it does, it's just to put in your wallet and to have with you. The next thing in the kit are medication forms, and they give you a bunch of them, and you just, you fill them out personally to you. And so that way you can bring this with you to let your doctor know what medications you take while you're in the hospital. That is available to download and print for free. It's in the Aware and Care packet for free, and it's also in the Aware and Care kit. If you download the form from the computer, you can fill it out on the computer and then print it out that way too, if you don't want to print it out by hand. There is a hospital action plan. It's a booklet. And this you can download and print. Here's the booklet in that way, I guess. And it's in the Aware and Care kit. It will not be in the Aware and Care packet, but you can download and print it if you want to do that. And it just tells you how to prepare for your next hospital visit and has some checklists and things to consider. And then there's some additional materials. Again, you can download and print these for free, or it's in the Aware and Care kit. If you've had DBS, it notifies hospital staff that you've had DBS. I have that in the kit. I don't have DBS, but I note that I do not have DBS. So then it's just helpful for them to know that. If you have the pump, the duopa, I never know how to say that, I never say it right. But anyway, if you have the pump, it's the same thing. I noted on mine, I do not have it, but you can download and print that, and it is in the Aware and Care kit as well. Of course, if you have either one of those or both of those, it's very important that it's in the kit that you can notify people that you do have those. And then there are some print-only materials that it's not included in the kit or the packet, but you can go online and print these if you'd like. There are doctor's letters for planned surgery. So there's various versions. There's one if you don't have DBS or the pump. There's one for DBS, one for the pump, and one for both. So if you go to parkinson.org/aware and care and click on the resource section, you will find all 4 versions there. If you know you're having planned surgery, that's probably a good thing to do, because it will give the surgical team the right information from your doctor. And then there's also another doctor letter for any hospitalization, which you may want to print off as well. It's there under parkinson.org/letter. You can just keep it with you. And they're kind of recommending that during COVID, because any of us could end up in the hospital because of COVID, that you might want to have that signed by your primary Parkinson care provider. So the kit only materials, I showed you the bag. So you do get the bag with it, which has enough room in here also to keep medications in as well. So the things that come with the bag do not take up the entire bag. So there is room for medications. The thing in the middle there that you're seeing is actually a magnet that you could attach to, because the beds in hospitals are metal. So you could put it there. So hopefully that they see that and that they know that you need your medications on time, every time. And then lastly, there's a bracelet. If you feel that would be helpful to you to wear to notify somebody that you have Parkinson's. I don't wear mine personally. However, I do keep it in my car. It's in like the center console thing in my car, just in case there were ever an accident and somebody needs to know that. So, and if you do not have the kit bag and you don't wish to have a kit bag, they do recommend that you establish a specific bag to hold all materials and keep several days of each medication in their original and most recent bottles. You want to bring them. Now, having said that, they're going to want them in the original bottles or they can't do anything with those. But remember, they're likely going to take the medicine from you anyway. They will not, most will not let you administer them yourself or a family administer them to you. But by having them there, they know exactly what you take. And hopefully if they can just use yours, or if those are about to run out or something, they can at least order exactly what your medication is. So when to use the Aware and Care materials? Well, you can plan or an emergency hospital stay. I mean, I think the best thing to do, I have mine packed, and it is literally sitting in a little basket near the door to the garage to head out. So if something were to go wrong, myself or probably my husband could grab the bag, but at least we know where it is. We're not trying to rummage through a closet to find it. It's somewhere very accessible. You may want to bring it to your annual checkup with your Parkinson's doctor. A good thing to bring, because it helps educate them as well. And we'll talk later about part of what we're supposed to be doing as ambassadors is also educating clinicians. And so by having the kit, that helps us to educate more clinicians about the kit. You can use it when you're traveling. You know, don't put your Parkinson's med in your luggage and then check your luggage, because you may end up in Hawaii or Europe or wherever, and your luggage is somewhere else. It's not with you in Hawaii. So if you have your medications in here and you put some in your luggage, that's fine. But at least if you have some in here, you know that you're not going to run out, that if the luggage goes astray, you can still do something about it and still take your meds on time. And then also in extreme weather emergencies, you know, we had a tornado a little over a year or so ago here, which was quite devastating for many people who lost their homes. So having a bag like this that you can just readily pick up and leave with, that way you're not trying to get your medications when you're already stressed because your house may be damaged or somebody in your family is hurt or you're hurt. So it's important to use it in that situation as well. And to summarize, the Aware and Care program is a national campaign to prepare and empower people with Parkinson's disease through tools and information to be your own advocate in the hospital setting and an engaged partner in your healthcare overall. And remember, you're your best advocate. You know what you're feeling, you know what you need. And if you can't do that, then your care partner can. But we also hope to educate healthcare providers and staff to help people with Parkinson's get the best possible care while in the hospital. Because again, many times they're not seeing that many Parkinson's patients. So they really just don't know what that patient needs. And this is what the Aware and Care ambassadors are trained to do. The first one is to educate the community. If people with Parkinson's know what they need, they are more likely to get the appropriate care. Educate clinicians who treat Parkinson's. If clinicians help spread the word about resources, we can share them with more people with Parkinson's. And lastly, educate hospital staff. If staff know what people with Parkinson's need and why, they are more likely to adjust the care given. Because again, it's one of those, they don't know what they don't know. I don't believe that doctors and nurses and hospital staff want to harm a patient intentionally or want to do something that will put that patient in harm's way. They just don't know how much a Parkinson's patient needs that medication and how important it is to be timely and the exact dosage and the exact kind of medication that their doctor prescribed for them. And these kits are made possible by the Parkinson's Foundation. And you can see also that philanthropic foundation as well, because the goal is to get them into the hands of as many people as possible. They're not trying to make a profit or anything like that with them. So if you know people who need them, you know, please let me know. And again, the Parkinson's Foundation, it makes life better for people with Parkinson's disease by improving care and advancing research toward a cure. So, and then you can see if you go to parkinson.org, you can look on their website. There's lots of materials out there. And then that helpline has a lot of availability. It's open pretty long hours during Monday through Friday. So, but there's a lot of resources on there. They offer a lot of books. The books are now even available as a Kindle option as well. But you can order the books as well. And they have a lot of webinars and all sorts of things that are available to people to educate themselves. So, And so I hope that's helpful. If you have any questions, I'm happy to take them.
So for questions, you can either type them in the chat or unmute yourselves.
There we go. So if you have any questions, and like I said, if you're interested in the kit, I am happy to bring one to you. But I will need your contact information. That's the only thing. And I can drive it over to you sometime next week. And if you get it from me, it's free. There's not even an $8 shipping charge because they'll ship them to me for free. But they can't ship them individually to everybody. They're shipping them to me in bulk. So, oh, okay. I see somebody, let me take down, I saw somebody in the chat here, so let me take it down in case I can't get it after the fact. So, and thank you for listening. I appreciate you doing that. We had, I had quite a few people who asked for kits when I did the Beyond the Diagnosis the other day. So that was good.
We sure appreciate having you, Marcie, and sharing this info because to your point, healthcare professionals all get into it because they want to help people. So no one has the intent of causing trouble, but the more, just like with anything else facing Parkinson's disease, the more anyone can do for themselves and serve as your own advocate, the better, because to your point, hospitals are keenly focused on things that affect the majority of the population and certainly may have plenty of training on Parkinson's disease, but just may lose sight of some things in the everyday shuffle of handling everything. So it's great to be able to speak up for yourselves. It's even better to have an official kit. And I'll also ask that maybe we get some of those from you, Marcie, to have here at the gym in case a few people need some.
Yep. I mean, I can leave some there. The only thing I'd have to ask is I'm required to get contact information.
Yeah, that's no problem at all. I'll make that a prerequisite for taking one. So that's no problem. Does anyone have questions, comments, feedback, concerns for our good friend Marcie?
I do. This is Sharon. I just wanted to thank you again, Marcie. You're so articulate and expressed your thoughts very well. It was a wonderful presentation. I appreciate it.
Oh, well, thank you very much. Hopefully it'll help some people because like I said, the stories I've heard just, wow.
Yeah,
just,
I bet.
Yeah, I mean, really sad. People being put in very bad circumstances that could have been avoided rather easily. So, well, but again, as Mike said, you know, they're not trying to hurt anybody. It's just they don't know.
Exactly. Well, this really helped with awareness. Thank you again.
Oh, you're welcome. Thank you.
Sharon, that was really a great presentation. I totally had that problem when I was when I had my hysterectomy about 5 years ago. They did not have the medication that I needed, the dosage. And so I finally just said, well, let me just take my own. So I think it's a real good rule of thumb to carry at least a day's worth of your medication with you in the event of an emergency, or at least a dose or two. You can.
And they do recommend keeping, you know, a decent supply in here. If you can keep, obviously you have to keep rotating it out. Don't leave it sitting in there.
Right.
So
you
that,
can't leave it sitting
you know,
in your
2
car
years
either.
from now, it's no good. But, you know, if you can get, you know, even ask the pharmacist to split your dose. If you're normally getting like 90 days supply of it or 30 days supply, split it, but it needs to be in original containers. And you were lucky, Beth, to be honest, that they allowed you to take it because many will.
They didn't.
Oh, they didn't. You just did
I
anyway.
had it my husband had it and I had it in my purse.
Oh, gotcha.
And when they didn't bring it up, I said, look, I got to take it.
Right.
I think I didn't even let them know.
Yeah. So, yeah, because most of the time they will kind of abscond with it, but
I know.
it's just, somebody shared with me the other day that he went for DBS and they were not good about giving him his meds, ironically enough, because he was getting DBS because he has Parkinson's. I don't know that there's any other reason to have DBS, but maybe there are lots of reasons that I'm unaware of. But anyway, they didn't give him his meds, and his wife was trying very hard to advocate for him. The problem was it's only like a couple weeks ago, so it was during COVID.
Oh,
So she really wasn't allowed in.
Mm-hmm.
So that was just adding another layer to the problems. And then he said they came to take his meds because he actually had the kit. They came to take his meds. They wouldn't take the bottles. So then the pharmacist said they couldn't fill it because it wasn't in the original bottles. Like they couldn't distribute it to him, but they caused the problem themselves. And I told them, well, unfortunately, I think hospitals are just in over their heads right now because of COVID. And I think too many things are just coming at them and they can't handle it all. But he finally got his meds because somebody took pity on him because they saw him in recovery having a very difficult time.
Yeah, definitely.
And so finally somebody said, oh, what's going on here? And then he finally started to get the help, but his wife was getting obviously very frustrated because of COVID, and she couldn't, although she was trying very hard to advocate for him, she was having difficulties because of the circumstances.
Yeah, I guess I was lucky in my situation because the nurse said, hey, if you have it, then take it.
Yeah.
You know, and I said,
yeah,
okay.
But that's the luck of the draw too, is who you get.
That's totally true because it's against hospital policy.
Yeah.
Well, we certainly appreciate your sharing some stories and experience with us here, Marcie. And again, I'm going to try to get this recording out there for others. So they've also got access to it, because there are more than a handful of folks from our gang who emailed me and said that they wanted to attend today, but they had some sort of schedule conflict. So we'll see how the video quality looks and all that, and consider getting it out. But thank you all for showing up. Thank you, Marcie, for saving the day and giving us great info. And just to remind you of a couple of upcoming things, we're now entering February in the very near future, which is a wild thought. Mm-hmm. February the 20th, our good friends at the Davis Finney Foundation are going to do a Victory Summit webinar that's emphasizing information for newly diagnosed people with Parkinson's. So could be helpful review, even if it's been a while, or if you know someone who was newly diagnosed, they may want to join us. That's going to be on Saturday, the 20th of February. The following week, many of you Tai Chi aficionados out there from our Tribe Wellness Tai Chi groups have heard me make reference to this, but we're in for a special treat. My Tai Chi instructor, Master Jia, is going to offer a special class for us. It'll be an hour of Qigong, which is often taught with Tai Chi, similar functional purpose of working on slow meditative movements, and has been heavily researched and validated for people with Parkinson disease in terms of improving postural control and working on balance impairments with Parkinson's. Master Jia is going to do a special Qigong for brain health routine with us. And we're also doing that as a fundraiser for him. Like a lot of folks, COVID has shut down a lot of businesses. And so we want to do this as a way to try and help him. And if you can contribute $15 to attend that, we'd love to have you do it. And if you can't, come anyway. We'd still love to have you. And we're going to send whatever proceeds we collect to Master Jia. So Those are two big events coming late in February. On the 20th, the Davis Finney Foundation. On the 27th, Qigong for Brain Health. If you have other questions or concerns, always feel free to let me know. Or you can always check our website, tribewellness.org, for plenty of information. On top of that, anything else? Oh, if you haven't worked out yet today, don't worry. We've got boxing at 1:30 online, and Dr. Iram is going to run our sit and stretch group at 3 p.m. So there's no shortage of things to do, no reason to be bored. And if you have more questions or concerns, let us know. Again, thank you. Big thanks to you, Marcie. We appreciate you.
Well, thank you, Mike. We appreciate you. And I will try to contact the people who contacted me through the chat this weekend sometime, but you're welcome to email me. Again, it's marcie.salamone@gmail.com. And I'm happy to bring you a kit.
All right, everybody. Thanks for
Mike.
showing up. As always, take good care. See you.
Feel better, Mike.